Cataract surgery is a modern-day procedure to help those patients, particularly those who are more elderly, who tend to develop cataracts, to help them see better. And what cataracts are a clouding of the natural lens of the eye behind the pupil. And as that lens becomes more clouded, typically due to aging, but in younger patients, they can develop cataracts due to trauma, due to medical conditions such as diabetes, due to certain medications such as prednisone or steroids. They can accelerate the cataract process as well. So in a cataract procedure, by removing that clouded lens, which is referred to as the cataract, and then replacing it with a new synthetic artificial lens, otherwise known as an intraocular lens implant, one is able to restore that vision that they had years ago. So one of the most gratifying procedures that we as physicians and surgeons can do, because there's nothing better than restoring a person's eyesight. Modern-day cataract surgery, which I perform, is typically a no-stitch procedure. Now, in some cases, it is a no-stitch, no-patch procedure, meaning that those individuals have the surgery performed just under eye drop anesthesia. In others who are more anxious or squeeze their eyes heavily, we do it with the traditional anesthetic where their eye is fully numbed. The cataract procedure itself typically takes about 10 to 15 minutes on most individuals. And with the new lens implant that is inserted after the cataract is removed, the patient can typically see quite well within the first 24 hours to 48 hours. Once their vision has improved, they can certainly resume all their normal physical activities. We do not place any restrictions on bending or lifting or exercising. About the only restriction I ask is that they do not swim underwater so as to avoid any chlorinated water in their eye. Cataract surgery has an enormous impact on a person's life by restoring their ability to function the way they used to. They can see street signs much better, they can read the fine print much better, and with the advent of newer premium lens implants, in many cases they can see both distance and reading up close without any eyeglasses. So clearly it's a life-changing event for most patients and a very gratifying surgery for ophthalmologists such as myself.